Hello, everyone. My name is Laura Siegel. I am the Director for Deaf, Hard of Hearing, and DeafBlind Services for the Department of the Division of Aging and Independent Living. Today we have with us Representative Leslie Goldman and Representative Wood. And I'll give a quick visual description of myself. I am a white woman in my 30s with long brown hair. I have windows behind me, and I'm in my office in Waterbury, Vermont. Representative Wood, would you like to introduce yourself?
Thank you. Yes. Hello. My name is Theresa Wood, and I live in Waterbury. And I also represent the towns of Bolton, Buell's Gore, and Huntington. And this is, I just finished up the my seventh year in the legislature. I am the vice chair of the House Human Services Committee. And I previously was the deputy commissioner at the Department of Disabilities, Aging and Independent Living, where Laura works now. And I am a white woman with lots of freckles, reddish hair. And today I'm wearing my reading glasses and I have kind of a faded out, blurry background. And I'm sitting in my makeshift office at my house in Waterbury. It's lovely to be with you all.
Representative Goldman, would you like to introduce yourself?
Happy to. I am Representative Leslie Goldman. I represent Wyndham 3, which is down in the Bellows Falls area. It includes Rockingham, Athens, Grafton, Wyndham, and Brookline. We are going to be reapportioned, so that district is going away. So that's an interesting wrinkle in the upcoming election. I am a white woman with black hair that's graying. I'm in my 60s, late 60s. I am at home in Rockingham looking out my window at these tree peonies, which are in full bloom, and they're pink and gorgeous. Behind me are books, and my dog is by my side too. So it's really a pleasure to meet you.
Great. So the purpose of today's conversation is to talk about H.266. This is the bill related to coverage of hearing aids. So if you wouldn't mind, if one of you wouldn't mind talking about the process of the bill and how it came to fruition.
I think I'll start since I was the lead sponsor of the bill. So insurance coverage for hearing aids has been a problem for a long time. And part of my interest in making a change in this is my long career in disability services. And I was approached by Cove and Ruby Baker to see if I would be the lead sponsor on this bill, which they had tried previously I'm not sure, to be honest with you, how many years they've tried to get this passed, but so I know that it's been a while. It's been more than once. So this last time we were successful. It involved the process of a bill involves essentially getting a sponsor, which in this case was myself as the lead sponsor, and then working with our attorneys in legislative council to draft a bill. And often people in the community who have an interest in this can also be involved in the input in terms of the drafting of a bill. So because Cove and Ruby and other advocates had experience with this, they had some very specific ideas about what they wanted to see in a draft bill. And so as legislators, we can authorize our legislative council to work with other people and to come back to us with a draft. And that's what happened in the case of this bill. And then I reviewed the draft. We made some small changes. Well, they weren't really small, but they were they were impactful changes. And I looked for some key co-sponsors if anybody wanted to be a co-sponsor. Now, remember, this bill was introduced in the first year of the biennium. And so we were all legislating via Zoom. So usually in a situation like this, I would go around to different people in the building who I would think might be interested in co-sponsoring this bill, and I would get their signatures on a signature page. And that didn't happen because we were all legislating from our home offices. And so, I just kind of put out an email, and then people responded back who were interested in this bill. It was then introduced and sent to the Healthcare Committee. And I did spend, I can say, some time talking with the chair of the Healthcare Committee to try to get the bill taken up last year. And what I learned in this process is that there would need to be some background work. And that's with the Department of Financial Regulation around, because they regulate insurance coverage. And so Representative Lippert had asked for that work to be done last summer and then to report back to the committee. And then the committee took it from there. And I think I will then now turn it over to Representative Goldman to say what process the committee took in reviewing the bill, because it was my job to introduce it and to advocate to get it taken up. And then it was the Healthcare Committee's job to, once they agreed to take it up, to move it through the process.
That is a beautiful description. I really appreciate you starting the conversation for how this bill came to fruition. And Representative Goldman, can you explain your involvement in the process?
Of course. And it's really interesting to hear Representative Woods filling me in on this background, because I had no clue, of course, what was going on. I, of course, was at home. And as I say, a new legislator. So how these things sort of navigate the system, I'm still learning. And so this was a really good opportunity to learn the background on H.266. When Representative Wood sent out the request for sponsors, 2 members of the Healthcare Committee did agree to sign on, myself and Representative Cordes. So I think, we were both nurses, actually. She works in the hospital. I'm a family nurse practitioner. I'm now retired, but I did do it for 37 years. I'm aware of the huge impact of loss of hearing on people's lives. So to have access to hearing aids, I think is a really important tool. I was also sort of stunned by the frustration, because lots of hearing loss happens in our aging population, which of course is covered by Medicare, which we as a state do not have access to. So there's that frustration. I'd love to be able to see that happen, but we did what we could in our own little state, which was good. So I think it was really up to leadership in the second year of the biennium to make the decision to bring the bill forward. That's how it works. We had many bills presented to us, and we could only really discuss a few. Time constraints and the reality of the sort of content of the bill. And this bill rose to the top because of its importance. But I think a lot is because of the advocacy and the continued, I don't want to say pressure, but bringing it forward, bringing it to light of the issue of the problem that needed addressing, which inspired, I'll say, leadership to take this bill on and move it forward. Chair Lippert asked me to be the reporter of the bill, and that's the person that takes it to the full House to get approval. Once it goes through the full House, it has to go to the Senate. The Senate might change it or amend it or it might not. In this case, if they didn't, let's say it goes directly to governor for signature. If they do amend it, and in this case they did, but only in very, very trivial ways, it comes back to the House. We agree with the Senate, and then it goes on to the governor. We're of course happy that the governor has signed it. So there were really, just to summarize, three aspects of the bill that, you know, we were able to get through. And one is Medicaid has been covering hearing aids, but it wasn't, they weren't committed to it. They didn't have to, or they could change their rules. But this bill made it sort of in law that they couldn't change those rules, that Medicaid had to continue coverage of hearing aids and related services. The next piece becomes complicated because it has to do with the Affordable Care Act and how things get changed in the markets that the Affordable Care Act covers, which is the individual and small group market. And as Representative Wood said, that process was going on at the request of Representative Lippert. That's still in process, but it's being recommended. So that's great. So we affirmed in this bill to continue ongoing efforts to make hearing aids and related services part of what's called the benchmark plan in the small and individual group markets. And then the third piece was to make hearing aids and related services more accessible to Vermont residents requiring coverage in the large group market. And that's employers that get their insurance companies for their employees directly from insurance companies. There's another whole other large group market that's a federally sort of what's the word, regulated. We don't have access to that group, but this bill affirms hearing aid coverage in all the groups if everything goes through the way we want, which we expect it will, like through the Department of Financial Regulation, as Representative Wood said, to have hearing aid coverage in all the markets we have access to. So that's good. That's the ultimate goal, and we succeeded. I hope
that is great. Thank you so much for that, for those details and expanding a bit on the markets. That is an incredible explanation.
Yeah, I hope it's clear enough. It's very confusing, but if you have questions about it, let me know.
Okay. You know, I would say if people are watching this video and they have questions, that they should, you know, feel free to be able to reach out to either of you, if that's okay, and ask some follow-up questions.
Sure.
Great. So the other thing that I'm curious about is, now that this bill has become law, what does that exactly mean for people? What does that look like? How does that impact the everyday Vermonter? So could somebody today go ahead and buy a hearing aid and have it covered under their insurance, or are we not quite there yet?
That is a little ambitious, yes. The one thing that I will say, because not everybody knows this, the Representative Goldman referred to essentially the self-insured larger companies. So like the state of Vermont, some of the very large, corporations, they self-insure. Those are governed by federal rules. And I do want to point out, because I have received calls from people or emails, that the Vermont State Employees Association does begin coverage this year, July 1st. And so if there are any state employees who are looking at this or who have family members who are covered by their policies, that will go into effect July 1st. The benefit is not, I will say, not as generous as the benefit that's in this bill. However, it is a start, and the impact of this bill is to set the stage and kind of, I guess, if you will, peer pressure. So I think you'll see other self-insured organizations. I think you'll see the teachers' health insurance plan, for instance, another big self-insured group. I think that you will see them follow suit in short order. It certainly will be a subject of negotiation, I imagine. So what does this mean for the average Vermonter? For state employees, they're going to be able to get it, and retirees of state, they'll be able to get it July 1st. There's implementation time. The Green Mountain Care Board is involved, and I think it's for policy year beginning 2024. And policy years generally start in January. Is that correct, Leslie?
Yeah, that is correct. And we're waiting for this essential health benefit process to complete itself. So we haven't heard back yet from CMS, who are the regulators, at the federal level. We expect that to get improved. That's where the Green Mountain Care Board comes in, exactly right. Once they give the approval, then the insurance companies have to look at their offerings and the benefit packages and see how that all fits together. So that's why it will be offered in the benefit year 2024. I'm a little astounded at how long things take to get done as we move through the legislative process, but that is a true thing. There's a lot of detail that needs exploration, and nothing gets overlooked.
Yes. Yep. It's very, very interesting. Since this bill has passed, several folks from other states have started to ask me, how did this happen in Vermont? What did you all do? So I'm curious, do you have any advice for the other states that are considering a similar plan?
I think Representative Goldman hit the nail on the head when she said advocacy had a lot to do with this. There was a statewide petition, as you know, that was making its rounds 2 summers ago now, I think, and had a lot of signatures on that petition. There needs to be sort of what I would call inside advocacy, inside the State House advocacy. And I won't say that I was a thorn in Representative Lippert's side, but maybe just a tiny little one. It helps to build relationships in the State House, and I think that the impact of this bill became very clear when they started hearing from people, not just the petition, but there were lots of emails. There were lots of emails about this, about the need for this, and it's one of the things, I'll be honest, it's one of the things that I didn't anticipate, but I have received, huge amount of feedback when the bill passed, and even just introducing the bill from people who I would not necessarily expect to hear from, who are impacted by the loss of hearing. And, the people who spoke with me, some of them had the ability to, save up and purchase hearing aids. My mother was one of those people, she had the ability to do that. However, there were so many people who were not, they're very expensive, and were not able to afford the hearing aids that they needed, or they waited, 5 or 6 years before they could replace them, when, we know how quickly the technology is changing in this regard. So I was, I guess I shouldn't have been surprised at the large impact that this would have, but there are many people who will benefit from this.
And just to add something, for the record, it doesn't necessarily mean that the insurance is going to cover the entire cost of the hearing aid. Is that correct? Because hearing aids have quite a range in price. So they could be $1,000 or $7,000. And how they are replaced really depends on the individual, their level of use of these hearing aids, the type of hearing aids, what they kind of do in the world. So when I think about myself, I have, I don't know, probably half a dozen times purchased hearing aids, and have tried to extend that for this very reason. And I recall having a hearing aid for 10 years just because I didn't want to have to pay for the extra cost. And for me, taking great care of that hearing aid made substantial difference in its longevity. Representative Goldman, did you have something else you wanted to say?
I did. I just wanted to add to what Representative Wood said is that once the bill was taken up by leadership, the hearing community, Cove and advocates came and testified. And the testimony was incredibly compelling. So when you had that kind of advocacy in person and also using the technology, when I reported the bill, people were in the chamber were overwhelmed by the large screen with the translator doing their work. It really brought, I think, the chamber into the experience of people who have trouble with hearing. It was very compelling. So it was, behind the scenes, and then it became in front of the scenes, and then it really became in front of the scenes when we were in the House chamber. It was really pretty overwhelming. There's a picture of me reporting the bill with a giant screen behind me with the translator doing their work. It was profound. Yeah, almost emotional. Someone came up to me after and said, after you reported the bill, I was tearful. So
that was my experience, Leslie.
Yeah.
I have to say, I got goosebumps. It was tearful for me to see the level of accessibility that we should have more frequently in the building. And I was overcome with it. And I really, it's a lesson for us. I know that a couple of years ago, I can't remember now what the bill was, but I have a constituent who is deafblind, and trying to get just in committee, trying to have him testify in committee on a bill, and working with our legislative operations office. Let's just say they came a long way during this process with, I'm sure, much assistance and prompts from you, Laura, and other people who could provide them with the information that they needed. But it was a long way from where I was 4 years ago with a constituent trying to testify in committee. So we have a long ways to go to make the legislature as accessible as possible. And, we started using closed captioning, but the captioning service is so bad that they actually stopped using it. I think that we need to figure out a way. It's not physically possible to have an interpreter every committee meeting on every bill in, for the whole time in the legislature, but we need to figure out a process where people who have an interest in a bill are able to follow it in a way that's meaningful to them, and not just a bill that, is about hearing aids. If somebody who is deaf has, is concerned about the climate, they need to be able to follow a climate bill, for instance. So we need to do a better job at that. And this bill has shown us that we can do a better job.
I would
Yes, I think, that silver lining of this pandemic was a bit of a wake-up call, and really brought to the table substantial gaps in accessibility. And you are correct, I have been pretty assertive, sharing a lot of suggestions and ideas with the State House on how they can provide this level of accessibility. And this is a ball that I refuse to allow to drop. So we will continue to do that work in improvement overall. And at some point we will be back in person, and there needs to be some consideration for what access looks like at that point. Even if we go back 50-50, there has to be that consideration. Yeah, I think we've really covered everything. I'm so appreciative of both of your time and your thoughts. And I hope that the audience who watches really enjoys what we've had to say today.
I appreciate so much, Laura, you doing this. And again, it's increasing the accessibility of what we have done at the State House. And I very much appreciate the opportunity to be here today. So thank you.
And I would like,
Go ahead, Representative Goldman.
yeah, I would just like to echo Representative Wood's words earlier about accessibility and broadening it to other topics. I think it's really important. And appreciate the opportunity to be here and appreciated the opportunity to present this bill. It was really a powerful experience. I'm getting tearful just thinking about it.
Great. Thank you so much.